Hello, everyone. It is Wednesday, June 3rd. The days keep creeping by and we are now into June, and it's nice to be here. Again, I feel like I always start with weather, but anytime we have sunshine, it's wonderful. And I know that many of you experienced some storms last night, so I'm hoping that you are all okay and your yards aren't too much of a mess. I'm grateful to be here with you today. So to start out with the case numbers, we have had a number of cases coming in. In fact, since last Friday, which was our last media briefing with you, we have had 9 cases total come in. Today, we have 3 additional cases from yesterday, and our total is at 63. We have had 6,371 negative test results. And thankfully, we continue to have no one currently hospitalized and no one has died from La Crosse County from COVID-19. In Wisconsin, our total number of positive tests is 19,400. That is an increase from yesterday of 483. Negative test results number is 279,711. That is up 15,968 from yesterday. So you can see lots of testing is happening. Hospitalizations are at 2,700. We have had, that is an increase from yesterday of 57 and is a percentage of 14. So 14% of those that have the disease in Wisconsin have been hospitalized. Deaths in Wisconsin went up 9 from yesterday and totals 616 lives lost from COVID-19 in Wisconsinites. The Cooley COVID-19 Compass, this is our second week now in the Compass, and you will have noticed that it updated as of about noon today. I think slightly before noon it was updated. We remain in the high risk category of orange. We see that our epidemiology area remains yellow and our public health area is also yellow. I want to talk just a little bit about that public health area because that is new to be in yellow. Last week it was in green. And one of the things that we are looking at there is how much time it takes for us to get the test results once someone's sample is processed. So we would like that to be within 24 hours. And there have been some instances where that has been longer than 24 hours. And we hope that that does not continue. In addition, it sometimes is difficult for us to get a hold of contacts within the time frame that we're trying to do that, which is 24 to 48 hours. And just to note that the contact tracing aspect of COVID-19, as you know, is an important tool for us to be able to talk to a case who's been diagnosed with COVID-19 and understand who they have been in contact with during the exposure period. We have had a couple of situations over the last week where individuals have been concerned about sharing contacts with us, and that concerns us because when we have more difficult time getting information about who may have been exposed, it makes the risk level for all of us go up because we have no idea, we have less control to understand where those exposures might have occurred. So we work really hard to establish positive rapport and help the individual understand why we need that information. But it has been a little more difficult than in the past, and talking with other health departments across the state, also seeing an uptick in challenges to get contact names and establishments where the cases have been has also increased across the state. So, that is something we're going to monitor carefully, and we do our very best to make sure that we can determine those exposures because it is important for anyone who might be exposed to be aware of that exposure and have guidance about what to do. A reminder about that we are going to be adding the regional data. So counties around us, Buffalo, Trempealeau, Jackson, Monroe, Vernon, Crawford, And then of course, La Crosse is already online. We will add those counties on Friday. That is the plan. And then just a reminder that we update that dashboard every Wednesday, midday around noon. The National Guard testing site is coming up on Monday. That is on June 8th. So please, anyone who has any symptoms at all, no matter how mild, that is a testing site that is for individuals in our community to have access to testing if you have any symptoms. I think this might be especially important because we have activities happening since the Safer at Home order went away. Businesses are opening up, establishments are opening up. We have individuals in our community who are out and about a bit more than they had been previously, which we now have moved from severe to high risk. And so we also have, our recommendations allow for additional movement. But I am concerned about, in particular, wanting to make sure that those who are involved in any activities that they're taking the necessary precautions. So if even if that isn't happening, the symptoms, if they begin, it's really critical to get tested. So one of the avenues, of course, is healthcare providers in our community. Another avenue is this testing site on Monday, June 8th. And again, that is at the Wisconsin Technical Center parking lot, and we will have information out about that. And then we also would have, if anyone has symptoms and cannot get tested, you can always contact the health department, and we'll do our best to get you tested if you have symptoms. Wanted to share that the food drive has now concluded, and the food drive happened every Friday from April 17th to May 29th. Over that 7-week period, 68,189 pounds of canned goods were collected. That is a lot of food. And $309,586.12 were also collected to support hunger needs in our community. And I think that is so important and just makes me very proud of this community coming together to support those needs. There were 2 separate matches. A couple matched $25,000, and the Firefighters Credit Union matched $50,000. And many people were involved in that, and we thank them as well as anyone who donated. We thank you as well. I now want to talk a little bit about racism and what's happening in our country right now. We yesterday, as you know, participated in Blackout Tuesday on our social media page, and that led us to not do the media briefing yesterday, to be very quiet so as to raise the voices of people of color in our community. And we then transferred our media briefing to today for that reason. I think it's important to talk about why racism is something in public health that we discuss. So first and foremost, the organization for Wisconsin, the Wisconsin Public Health Association, that guides and brings together health departments and public health professionals outside of health departments across the state, put out a statement, and I'd like to read it to you. In the midst of the latest killing of an African-American man, George Floyd, in Minneapolis, Minnesota, the Wisconsin Public Health Association shares the grief of Americans everywhere. Wisconsin Public Health Association calls on leaders for reform as the devastating effect of systemic racism and oppression targeting people of color in our communities continues. In the face of America's continued structural racism and violence against individuals and communities of color, we all must do more. Our hearts go out to Mr. Floyd and his family and to the people of Minneapolis, where lives are in jeopardy right now as residents come out of their homes in unsafe environments to condemn Mr. Floyd's killing. In addition, the Wisconsin Public Health Association published a resolution, and I'll read just a few snippets of this for you because I think it helps you understand, again, why this is an important public health issue. Racism causes persistent discrimination in housing, education, employment, and criminal justice. More than 100 studies have linked racism to worse health outcomes. Wisconsin must address persistent disparities in health outcomes, and therefore, we must assert that racism is a public health crisis affecting our entire society. So we know that there have been individuals who have not understood why we would have done the Blackout Tuesday yesterday. I hope that that helps you understand why we did that. And it really comes down to that everyone in our population is someone we serve. It doesn't matter what color they are. However, we also look at what we call disparities or differences between populations. And that can be along lines of color and race. It can be along lines of economics or income. It can be along other lines as well. And we look at all of those, and that's what we call an equity lens. And basically what we're doing is trying to make sure that everyone has the ability to have good health outcomes. Ultimately, that's what it's about. Myself personally, I will just share that my journey along this line started about 2 years ago. We have a wonderful resource in our community in the Health Summit. And 2 years ago in the Health Summit, there were several speakers on this topic, one of which was Shondell Spivey. And I remember hearing about the term microaggressions and hearing about the term colorblindness. And I remember feeling uncomfortable. I remember feeling a little upset because it challenged me personally. And I feel like I'm a good person. And yet it was challenging me in a way that was new and different. And I think it takes that for some of us to begin to process that the way that our society is structured does inherently give benefit to some over and more than others. So I am grateful for that moment in my life because it opened me to be willing to learn and listen more than I had been in the past, even though I have people of color in my family. I think it was eye-opening and an important part of really marked the start of my journey. So it is my hope that all of us can be willing to learn and listen and be willing to step onto that journey, knowing that it may take years, decades even, to understand really what it is. And so I just share that with you because I think it's really important to explain why we participated yesterday and why racism is a public health crisis. So with that, I do want to say that, the protests that are happening right now, even locally relating to this topic, I am concerned about those that are perhaps not wearing fabric face coverings and maybe not doing proper physical distancing. And I think what would be extremely tragic is if exposures during peaceful protests about a topic of importance might lead to disease, especially in a population that has been hit harder with this disease than others. So we see in the data, not necessarily locally yet, but definitely in the state and across the nation, that people of color have been hit harder by COVID-19. So we would ask that as you participate in those activities, please protect each other by wearing fabric face coverings and keeping distance of 6 feet between individuals in order to prevent the spread of COVID-19. With that, we have a guest with us today, Sarah Johnson. You may recognize her. She is certainly a favorite of ours, and Sarah brings to us an important message always about mental health and wellness and how we can care for ourselves. We've talked about this in alignment with COVID-19, but also adding in current situations. Again, it's just so critical to remember that there are many facets of each individual, including mind, body, and spirit. So thank you, Sarah, so much for being with us today, and take it away.
Thank you, Jen. And I really appreciate both that the health department really spent time yesterday paying tribute and honoring and helping be a part of lifting up voices of our community members who maybe have not historically been heard, seen. And I also appreciate your honesty and your genuine really bravery in saying, you know what, I don't know it all. And I think that's a really important piece for all of us to be able to say, we're in a lot of uncertain times right now, and added to that, there's a lot that we don't know about each other. And so it's going to be important that we bring what's called cultural humility to conversations and our relationships, really realizing that to be truly empathic and to truly understand where someone else is coming from, we need to listen, we need to hear their stories, and we need to be willing to make space for that. So thank you for sharing that, Jen. I really appreciate that. For those of you who don't know me, I'm Sarah Johnson. I'm the mental health director for the La Crosse Area Family YMCA. And my role is really to try to share my skills and experience and training as both a prevention person, someone working to help promote health and reduce the risk that people become unhealthy, and as a clinician, so somebody who's worked as a counselor with people. I'm here to try to sprinkle that information in your brains because I think we all have mental health, and so we all need to know how to manage that mental health. Mental health is just how we think, feel, and act. So that's something that we all have, and you probably have noticed that the way you think or feel or act, or maybe all three, has probably been impacted in the last few months, and certainly in the last few weeks with some of the historical situations that we're finding ourselves in. So thinking about our current historical context, meaning where we are right this moment, I wanted to talk with you about our nervous system. Our nervous system is within our containers of our bodies, our container. Our nervous system is this really cool thing, and I'm going to way oversimplify it here, but essentially what it's there to do is to be a threat detection system. It's there to keep us alive. So thank you, nervous system, for prioritizing my life and trying to help me stay alive. The way it works is that it's very sensitive, so sensitive, in fact, that we don't even realize that it's happening. So our system kind of scans the universe and looks for signs of safety and signs of threat. And before we're even conscious of it, our nervous system fires up and prepares us to do what we need to do to stay alive. And that's either fight or run away or play dead like a possum. And so what happens in our system without our even realizing is that if our system thinks that there's a threat around us, it hears something, it sees something, it smells something, it just senses something in our gut. If you've ever heard that, I had a gut feeling, well, that's part of our nervous system. So our gut brain, our heart brain, and our brain all work together to keep us safe. So our threat detection system goes off and we start getting kind of ready for whatever we need to do, which means we tense up, we get more adrenaline, our heartbeat starts going faster, and our breathing starts getting more shallow. And the part of our brain that is activated is in the middle part of our brain called the limbic system. That's where our emotions live. And that's actually the first part of our brain that develops. So our brains kind of develop from the inside out. The last part of our brain to develop is up here behind our forehead. That's called the frontal cortex. This is the part of our brain that it makes much more logical decisions and can help us be more calm. We need both parts of our brain to be able to work together to make good decisions. So if you think about it, if you've ever been wound up, stressed out, upset by something, and sent a text message that you regretted or said a thing that you regretted, that's probably because you were still in that threat mode and in your limbic system. So that's, the gooey feelings part that didn't have a chance to talk to the frontal cortex, for the frontal cortex to say, do you really want to send that text message? Let's slow down a minute. Why am I telling you all of this? I'm telling you all of this because right now, many of us across the planet, maybe all of us, are walking around with fired up nervous systems. Between a virus that we can't see, our nervous system is detecting threat, right? And when we see things like masks and screens up and some of those sorts of things, even though those are things to keep us safe, our threat detection system goes, wait a minute, why do I need to stay safe? Is there a threat? So our nervous system is elevated. Add to that all of the stress that people maybe have in their life before this. Add to that the new stresses that have come along with that. And add to that some of the things like Jen was referencing, historic trauma and historic racism, structural racism, these big, complicated, complex concepts that not everybody understands. And that in and of itself feels like a threat, right? Like, I don't know this information, or are people telling me I'm bad, or I'm contributing to the problem? Makes our nervous systems go up because nobody wants to be bad. Everybody wants to be a good person. We don't always know what we don't know. So all of those pieces mean that many of us in our community are walking around in our limbic system, meaning that part of our brain that fires up and doesn't have the connection to logic, which is not great, right? We're all walking around like that. That's probably a recipe for things not going super well. And so we really need to work to notice, what is my nervous system doing right now? Is it elevated? And if so, I need to stop, pause, breathe, and determine, is there truly a threat right in front of me, or is it my nervous system just trying to protect me? Because it's very, very overprotective, and it's not always right about threat. Like, it errs on the side of caution. This is why I can walk down the trail, see a stick on the ground, and scream like a child, because my brain thinks that stick is a snake, right? It's not always right, but it's going to err on the side of caution to make sure that I am safe. And so it's going to put me in fight or flight. And even after I take a few breaths and I let my frontal cortex say, Sarah, it's okay. It's just a stick. It's not a snake. That helps me know it's not a snake, but my nervous system still needs time to calm down. So even after we take that first few breaths, determine, is there a threat here? Oh no, there's not actually a threat. I'm just feeling stressed. My nervous system just trying to protect me. We still need to do a little bit more work to help calm that system. And we're going to have to keep doing that work over and over and over again if we want to be able to show up our best selves in our relationships, for our children, for our neighbors, particularly our neighbors who are most struggling and suffering right now, to be able to solve problems creatively and effectively and design sustainable solutions. So over and over and over again, what I'm encouraging you to do is check into your nervous system, take those big, deep breaths in and out, notice what's happening in there, and do everything you can to calm that system. And if you're not able to do that on your own, that's something we call self-regulation. You're regulating your system, helping it down-regulate. Co-regulation is actually the best way to do that. And co-regulation is what we do in relationships with other people that we trust, who are safe, who can help us calm down. So very, very important to know that we're not born with this skill. Human babies need other people to survive. That's how we learn how to self-regulate. We learn it through co-regulation. And for those of us who maybe didn't have a stable or steady or consistent positive adult in our life when we were young, we might have some skills to learn yet, even as adults. So the good news is humans are very resilient. We can learn these skills and practice these skills. And I'm going to do it with you right here, right now. I'm going to take a nice deep breath in and out, and I'm going to encourage you to do it with me. Here we go. See what you notice in your system, even with one deep breath. I can tell that I'm talking a little slower and a little lower. So imagine the power of deep breaths throughout your day and connecting in a genuine way with other people that you trust who can help you soothe yourself and regulate your system over and over again as many times as you need. Now, if you don't have people that you feel like you can reach out to right now, I want to make sure that you know about some community and national resources that we have. So 24 hours a day, you can pick up the phone and talk to a trained professional at 211 just by dialing 211 on your phone. You can also call the National Disaster Distress Helpline. That number is 800-985-5990. You also, if you prefer to text, can text the word TALK to 741-741. Steady heads, open hearts. We do this through regulating our system. Steady heads, open hearts. Be safe, be well. Thanks, Jen, for letting me share some airwaves with you.
Does anyone else think that it has been too long since we had Sarah Johnson on? Oh my goodness. That's probably the first deep breath, Sarah, that I've taken for longer than I should probably share. So thank you. That was wonderful.
I'm glad you took a breath.
Yeah, it's very important. She tells me that a lot.
I tell everybody that a lot, and people tell me that too. We all need those reminders.
We do. Before we take questions, the last thing I wanted to mention is that we are going to change our schedule to move to doing these media briefings every Wednesday. It makes sense to us that we would do that since that's the day the data dashboard updates. We can then share with you what we think is important to note about that dashboard update, as well as anything else that is happening. In between times, if there's something urgent that pops up, we will certainly communicate through our regular channels, which can be social media, through media partners, and both actually. So that is going to start then today, and we will have a next media briefing next Wednesday. So with that, I will take any questions, or if you have any for Sarah.
I have one for you, Sarah. So prior to us kind of getting on here, I'd kind of jokingly talked about that fight or flight response. How unhealthy is it on your body to be able to feel that quite often, and maybe not in those specific situations where you really do need it?
That's a great question, Justin. You're asking about what are the long-term effects of having adrenaline, that fight or flight, and cortisol in our system. And there's a lot of research out there that says that having elevated levels of that for periods of time, and that can happen through experiencing trauma or other adversities, or having unmitigated stress. So meaning high level of stress without any other buffers to protect us. That can have a dramatic impact on our immune system, on our cardiac system. It puts us at higher risk for things like diabetes. And when Jen was talking about we see the long-term health impact of experiencing things like racism, poverty. These are why people of color are experiencing greater consequences to this illness, because many folks of color have experienced greater levels of stress related to some of these, what we call the social determinants of health. So what we really want to make sure is that we're doing everything we can to help buffer people from that stress, so that self-regulation, that co-regulation is really important. One of the things that is really most important in terms of building our own resilience and our ability to make it through difficult experiences like this is the presence of a really healthy, strong, stable, positive person in your life. So again, that's why I'm really always championing people building up their support and being honest, being genuine, talking about how they're feeling, so that we can help try to buffer some of that stress. I don't know if Jen maybe wants to add anything to that.
That was as thorough as I can imagine it could be.
Okay.
I have one for you now, Jen. With these new cases, I guess I know there's a lot of them, so I don't expect you to kind of go in on all of them, but what are maybe some of the age ranges? And I'm guessing that most of these are seen through community spread at this point.
Thanks, Justin. So just with today's 3 cases, and I think this kind of tells the whole story as well. We have a male in his 20s, we have a female in her 40s, and a male in his 70s. So we have had the entire gamut of age ranges. And, you know, some of the folks, as you can imagine, are connected to households or connected to a case. But that isn't always the situation. So we do have a handful that are not connected and don't have a linkage. Oftentimes we are looking for those linkages to see if it tells a bigger picture though. So for example, we have had a couple of cases that had a couple of contacts that were the same, but we initially didn't see that the cases were connected. So it is sort of like a puzzle in terms of trying to piece things together to determine where the original exposure actually took place, and that our team just does a really good job with that. But again, it does rely on the information that's provided to us through those important communications and conversations with those that have COVID-19 and those that have been exposed to COVID-19 and our team.
Justin again. Earlier you had spoken about kind of, excuse me. Earlier you had kind of spoken about going to speak with kind of Shondell Spivey and kind of learning some more issues related to racism in our country and everything like that. I was wondering if you might know of maybe some resources if people see this and are interested in maybe learning more or maybe breaking down some of those barriers themselves and kind of being more or less educated.
Yeah, I mean, there are many resources, right? So as Sarah holds up some of the books, there are some really important books. Oh, I haven't heard of that one. This book is anti-racist. I know that there's Waking Up White. Yep. And that's the one Sarah's holding up now. That is actually one that our community has chosen to read. And I think that's in conjunction with the Greater La Crosse Diversity Council. So Sarah's showing White Fragility. Look at, she's so prepared. I didn't even ask her to do that. Did you have another one there too, Sarah? No, okay. In addition, I think during typical times, not during COVID times, of course, but there have been, because of the Diversity Council in La Crosse County, there have been a number of events where individuals can monitor that website, the Greater La Crosse Diversity Council, and watch for learning opportunities. And one of them that I participated in, which I found to be really informative, was at the University of Wisconsin-La Crosse, and it was about the first development of the term white. Really was like a term that we came up with as a people way back in the days when the Declaration was being signed. So I think there are many opportunities to learn about racism, and it really just starts with a willingness to learn and listen, and to understand that the early part of this journey can be very frustrating and can lead to many questions, but to not let that stop the journey, because I think it's important, for us to be open and willing to listen and understand that people's experiences are different, whether that is based upon the color of your skin or the income that you make or where you live. There are many pieces in our society that make experiences quite variable across even our own county. And just to understand that that is happening every day and that people live different realities than just your own. So sometimes we even in our own circles of support don't have a lot of diversity, and that can make it difficult to feel safe in learning if you don't have contacts in your own circle that have different feelings or experiences than you do. So it does take a bit of a reach sometimes to be willing to look for that opportunity and engage in it. Anything else you would share there, Sarah?
Yeah, I have lots of resource lists that I could share with folks if they're interested. I also want to add, I don't have the information right off the tip of my tongue, but I know that on Monday night at 7 to 8:30 p.m., the Franciscan Spirituality Center is actually doing a workshop around learning about how to talk about race. So there's some great resources right here in our community to help us have these difficult conversations in ways that are compassionate and help us all learn. Nobody wants to make anybody feel stupid. Nobody wants to feel stupid. We don't always know what we don't know because, you know, we think that our own experience is what everyone's experienced, and that's simply not true. We don't know that. So helping each other understand each other's stories, like you said, can be intimidating at first, can make our nervous system kind of tingle. So we just have to breathe through it and be brave and know that we're being compassionate, we're being good neighbors when we allow ourselves to be nervous, scared, but take the chance to learn anyway.
Hi, Jen. With these 7 cases the last 2 days, is the health department concerned about maybe having opened up too soon? Or are these cases kind of expected as people return to a sense of normalcy and maybe, for lack of a better word, a good place to be?
That's a very good question, Haley. You know, because I don't have all of the details, my disease investigation and contact tracing team are the ones that have these conversations with the individuals. I can only tell you that I am concerned that we have individuals that are exposing themselves to risks in the community with places that are open, and many places are doing that as safely as they can. But there are situations that are not. And I think, you know, sometimes we don't always make the best decisions. I mean, we are all guilty of that. But again, it is about decreasing risk. It's always about decreasing risk. We're going to have a risk of COVID-19 that is part of our new normal. So it really is about having the ability to make good choices. And I just encourage individuals to, even though there's no order, to go to the website. The dashboard, we have heard, has been really helpful to many people, including myself. I point my family members to it. It's hard for me to always get questions about, is this okay? Is this okay? And it tells me that individuals are trying to figure out what they can do safely. And I think it really is about understanding what the recommendations currently are and looking at, that starts by looking at the dashboard and looking at, are we planning, you know, are you trying to have a social gathering? You know, and then making choices to decrease the risk. If it's not a choice between we're going to have it or not, if it's going to happen, then again, how can we make that risk lower? We can have it outside, we can have it spread out, and not in close quarters indoors. So again, it's just about doing the best we can to make good choices and lowering the risks wherever possible. So I don't know if we can point it to any one particular event, but I will also add that there are activities happening right now that we may see, you know, we may see cases related to in a week and a half to 2 weeks. So it's always a little bit of a lag time because what we call the incubation period, which is if someone is going to develop symptoms, it takes between 5 and 9 or 10 days to develop symptoms. And then we know some do not develop symptoms from the time that they are exposed. So that lag time makes it a little tougher. It's a longer incubation period than you would see with something like influenza. So it makes it a bit tougher to see that this happened related to that, for example. But travel is also something that concerns me. And as we travel for whatever reason, whether it's vacation or it's some kind of a social gathering, which is happening, or it's relating to, you know, whatever else it might be, we do bring additional risk to our community. And so I am concerned about travel. And all I can say is for us to just continue to do the best we can to decrease the risk and give it our best.
Justin with WKBT again. I think it's been about a week since you opened up that Compass now, give or take. I just want to kind of get your reaction on what you're hearing from it and I guess how smoothly it's been operating since it's opened up.
Yeah, thanks, Justin. We have heard, I think, many positive comments about the dashboard. There's a lot of information there. We did worry it might be too much information for some. We tried our very best to make sure that the landing page was really simple and gave you, you know, the most important message, but also that, you know, much information is available if you want to dig into it further. We have heard that there are parts of our community that have really appreciated the isolation and quarantine flow chart that we're using in some sectors of our community. That's important. And I think in general, it provides a guide, I mean, a compass really for all of us to make good choices. So we've gotten a lot of very good positive feedback. We're grateful for that. We really just wanted it to be a tool that would be useful and be used by our community members. And it seems to be that that is how it has been perceived. So we're thankful for that.
Sarah, we have a question for you from a community member on Facebook. They're saying that they have been quarantining since March or really staying home as much as possible and are now beginning to do more outings like going to the store and things and are experiencing some anxiety about that. Do you have any tips for someone experiencing anxiety as we begin to open up a little more?
Yes, that is so natural and so normal. And, you know, one of the things that we expect is that many of us are going to be experiencing more anxiety right now. And certainly as we go to open up, you know, you've been home and you've been in your little container and you've been safe. And now, you know, it feels like an even greater risk because you've had that safety and that protection. So a couple of things I would say. One, doing that breathing. There's actually a breath work that can be really helpful in minimizing and lowering anxiety. It's called the 4-7-8 breath. And it's most useful if you do it maybe 3 times a day. And it's about after 6 weeks, your whole system starts shifting to have some more long-term change. But you can have some good, just like subtle changes early on and right away. And so the way that works is an in-breath of 4, holding it for 7, and then an out-breath for 8, and then repeating. So it would be in 2, 3, 4, hold 1, 2, 3, 4, 5, 6, 7, out 1, 2, 3, 4, 5, 6, 7, 8, and repeat. So 4, 7, 8. Now, if you are kind of visualizing and mentally preparing yourself to go out, that can be really helpful too. So imagining a successful trip out, and you know, I'm doing all of the things I can to keep myself safe. I'm doing social distancing. I'm wearing my mask to protect others. I'm minimizing touching my face. I'm you know, going in and out as quickly as I can. I'm doing all of the precautions. So reminding yourself that that's your frontal cortex really helping your limbic system calm down. So again, you know, the limbic system is what's going to be loud and first. It needs the frontal cortex and those deep breaths to calm down. Finally, I would say if you're doing all of those things and you're avoiding caffeine and you're getting good rest and you're doing all of the things that help you feel good and moving your body, and you're still finding that you're really anxious, that's a really good time to reach out and talk to someone. And that could be calling 211, that could be setting up an appointment with a therapist. It could be talking with your primary care provider. And it doesn't mean you're going to go on medication necessarily, it just means they can help you kind of determine what might be most helpful for you. So those are just a few tips and tricks from me.
Any other questions for Jen or Sarah today? Go ahead, Jen.
Well, thank you guys so much. I know that from Sarah and Colleen and I, we all really appreciate being willing or being able to be with you guys during this time. And yeah, just keep up the great work. You're doing a really good job, and we appreciate all of you. And we will see you back here next Wednesday. Have a great week.